Exercise prevents almost 4 million premature deaths a year, research suggests. The benefits of regular physical activity are well known, with going for a walk, jog or cycle linked to everything from a reduced risk of cancer to improved mental health. To better understand how it impacts mortality, scientists from the University of Cambridge looked at data from 168 countries. Results suggest at least 3.9 million premature fatalities are warded off every year in people between 40 and 74 years old as a result of exercise. The scientists analyzed data that showed the proportion of people who met the World Health Organization's guidelines on exercise. It recommends either at least 150 minutes of moderate-intensity aerobic activity a week, 75 minutes of vigorous intensity exercise, or a combination of both. Results, published in The Lancet Global Health, reveal the countries whose residents achieved this varies substantially, from a third, 33%, in Kuwait, 64% in the UK, and 94% in Mozambique. This data was then combined with estimates on the risk of dying early among active people compared to those who do not exercise. In the UK and US alone, exercise is thought to save 26,600 and 140,200 lives a year, respectively. On a global scale, the fatality rate is said to be around 15% lower on average than if we were all sedentary. This was most marked in low-income countries, where 18% of premature fatalities are thought to be averted due to exercises, compared to 14% in high-income nations. Rather than focusing on how inactivity costs lives, the scientists hope to flip the message on its head by demonstrating how exercise helps people stay around longer. We're used to looking at the downsides of not getting enough activity, whether that's sports or a gym, or just a brisk walk at lunchtime, but by focusing on the number of lives saved, we can tell the good news story of what is already being achieved, said study author Dr. Tessa Strain. It tells us how much good is being done and helps us say, look how much benefit physical activity is already providing. Let's make things even better by increasing physical activity levels further. Read more. Food labels should list the exercise required to burn the calories. Co-author Dr. Paul Kelly from the University of Edinburgh added, research into lifestyle factors such as lack of physical activity, poor diet, drinking alcohol, and smoking tends to focus on the harms these do to health. This helps create a narrative to try and prevent and reduce these behaviors. The coronavirus outbreak means gyms are closed for the time being. The scientists therefore recommend people keep active by going for a daily walk, cycle or run, doing yoga, gardening, or joining an online class. Do not wear a mask while exercising, says the World Health Organization. WHO has urged people not to wear a mask while exercising in a bid to ward off the coronavirus. Face coverings are mandatory on public transport, while hospital staff are required to wear medical-grade masks. The advice around masks has been somewhat muddled. The WHO initially said there was no evidence masks ward off a viral airway infection, like the coronavirus, but they may stop patients passing it on. It has since updated its guidance, claiming face coverings could provide a barrier for potentially infectious droplets. While masks are generally considered beneficial, or at least harmless, the WHO has warned they should not be worn while exercising. Exercise has known benefits for physical and mental health. At the start of lockdown, we were not permitted to leave our home except for very limited purposes, which included to walk, jog or cycle. The advice has always been to maintain a safe distance from passers-by, but never to wear a mask, even if you have a telltale coronavirus symptom, fever, cough, or loss of taste or smell. The WHO has warned donning a mask while being active may make breathing uncomfortable. It recognizes labored breaths as a serious symptom of the coronavirus. Sweat may also make the mask wet, further hindering breathing and encouraging the growth of microorganisms. Experts previously pointed out masks become less effective at warding off viruses when damp, with all of us having moisture in our breath. With gyms closed for the time being, people are forced to exercise in their home, garden or public spaces. After following up the contacts of 110 coronavirus patients, scientists from Hokkaido University in Japan found the risk of the infection being passed on was nearly 19 times greater inside than outside. That being said, breathing heavily while exercising may aid coronavirus transmission, making social distancing all the more important. While indoors, masks are recommended for those over 60 or people with underlying health issues. People with coronavirus symptoms and those caring for them are also advised to use this extra protection. For everyone else, the WHO recommends a fabric covering of at least 3 layers of different material when out and about in confined spaces. Official guidance states one can be homemade out of an old t-shirt. These coverings should be combined with other preventative measures, like regular hand washing. What is the coronavirus? The coronavirus is one of 7 strains of a virus class that are known to infect humans. Others cause it everything from the common cold to severe acute respiratory syndrome, SARS, which killed 774 people during its 2002-2003 outbreak. Since the coronavirus outbreak was identified at the end of 2019, more than 8.3 million cases have been confirmed worldwide, according to Johns Hopkins University. Of these cases, over 4.1 million are known to have recovered. Globally, the death toll has exceeded 449,600. The coronavirus mainly spreads face-to-face via infected droplets expelled in a cough or sneeze. There is also evidence it is transmitted in feces and can survive on surfaces. Mild cases of the infection have no set treatment, with most patients naturally fighting it off. Those requiring hospitalization are given supportive care, like ventilation, while their immune system gets to work. The steroid dexamethasone is being used in NHS hospitals to reduce the risk of death among those on ventilators or oxygen. Thanks for watching. For more help, touch the links below. Feel free to subscribe for further assistance.